Next question. In your last teleseminar, you recommended implementing your low-carb approach for the non-diabetic children of type 1s to reduce their risk. Why would feeding my non-diabetic children a low-carb diet reduce their risk of type 1 diabetes? This is a common question.
Okay, because elevated blood sugars are toxic to beta cells. We cite in my book the story of Gerald Raven and the biostatter. In fact, I have a picture of the biostatter on my desktop that I show to patients whom I am training. He demonstrated beta cell recovery when the blood sugars of type 2 diabetics were brought down to what they thought in those days was normal for 2 weeks. So if you can get, now maybe my logic is wrong, but I say to myself, if you can get beta cell recovery from 2 weeks of normal blood sugars, you're also going to have reduced toxicity by continuous normal blood sugars. Now, type 1 diabetes is a continuum. It doesn't hit a kid all of a sudden. It involves multiple immune attacks, and they could be small attacks. They could reduce the number of active beta cells by maybe 5% in an attack. You wouldn't notice it on your blood sugars. But if you've lowered your total beta cell content 5%, and then another attack 10%, and you're eating a lot of sweet foods and keeping your blood sugars high like the standard American diet does with most people who consume it, that elevated blood sugar is going to help destroy beta cells. That's it. It's not that there's a magical big reason. And I've seen type 1 diabetes attack the siblings of patients of mine. And when I have one family where the mother only contacts me when there's trouble. And she has now 3 kids with type 1 diabetes and a husband. The husband does very well because he decides what he eats and so on. But she was managing her kids, including the non-diabetic ones, and she argued with me, said it's unfair to deprive those who are not diabetic. And we watched this kid who had early signs, and she continued to give him high carbohydrate foods. You know, his A1C was going up a little bit. And I seen another case where I was recommending the daughter of a patient of mine, a type 1 patient, where I was recommending not only a low-carb diet, but low-carb diet plus exercise plus a medication that's been reported to slow the onset of diabetes, protect beta cells. I believe it was Januvia, but could have been Avandia. Both of them have been shown to prevent beta cell burnout. But they turned me down on the medication, but they did follow through on a very strict low-carb diet and physical exercise. She became an athlete. And this has been going on several years, and her A1C has not gone up any further. We picked her up because she had an A1C of 5.3, which is high for kids. And they stopped it cold with just diet and exercise.
Awesome.
So I'm pretty convinced that's one of the things you have to do.
Yeah, well, in my families, I mean, it makes things easier if everybody's eating the same food and
Well,
it's
that's
healthy
another
food.
part of it
So
altogether.
I don't want to feed my youngest son a bunch of candy and sugar when the oldest son is a real pro at controlling the food that he eats. But and he wouldn't want to do that either. But yeah, I don't want to have two type ones be a real challenge.
Yeah, that's right.
Makes sense what you're saying. Hey,
Yeah,
let's side on the side of caution, right?
that's right.
All right.